Once again, the answer choices are covered up, and we will begin with the lead-in. Through which of the following veins did the second hormone most directly enter the systemic circulation? Through which of the following veins does the second hormone most directly enter the systemic circulation? I'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require, and then we'll read that vignette. A 43-year-old woman presents to the clinic with enlargement of her hands and feet, weight gain, and a tingling sensation in her palms. She complains of difficulty seeing things to the right of her. She is found to have an elevated level of a pituitary hormone that induces production of a second hormone to achieve many of its metabolic effects. Through which of the following veins does the second hormone most directly enter the systemic circulation? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? So now we've got a little bit more of a clinical scenario going on here. We've got a 43-year-old woman. Always want to make note of those demographics, okay? Because that's automatically going to clue you in as to what things you should be thinking about and help you come up with your differential diagnosis, okay? Then they often tell you, what are they presenting with? So in this case, she's presenting with acral or hand and feet enlargement, weight gain, some palm tingling sensation, okay? Always want to make note of what brought them in to be seen. And then usually they'll also tell you, how long has this been going on for? Is it acute? Is it a few hours, a few minutes? Or is it chronic, like a few months to years, okay? Didn't tell us that here, but a lot of times they may, and you also want to make note of that in that situation. They also tell us a little bit about some fission issues, some pituitary hormone levels that are elevated, and then they're asking us kind of a physiologic question based off of that. Okay, you can see there with that very last sentence in the vignette. So then in the lead-in, they're asking us through which vein does that second hormone most directly enter the systemic circulation? So I think we've got a few steps here. One, I think we've got to figure out exactly what is going on in this patient, okay? Two, what could be that elevated pituitary hormone? Three, what is then the second hormone that is produced? And then four, what vein does it enter into? So definitely a few steps here, a very nice multi-step question. So let's make sure that we don't lose track and we answer all those steps accordingly. So let's go ahead, let's take a look at those answer choices. Once again, we're going to start at the bottom and we're going to work our way up to the top with those answer choices. Answer choice E, splenic vein. D, portal vein. C, inferior vena cava. B, hypophyseal portal vein. And A, hepatic veins. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer. I know we've got a few steps here, so we'll give you a few seconds to think about this. And then we'll talk about it in just a few seconds.
Excellent. Thank you, Boris. So we'll give all of a few moments here to select what you believe is the correct answer. As you notice, we always review the correct and incorrect answer choices, and we encourage you to do that also when you're doing practice questions. It's the best way to learn, and you also want to make sure that you got it right for the right reasons. I see the responses coming in. We'll give all of you a few more moments here. All right. A few more seconds here. So let's go ahead and take a look here and see what all of you selected. In first place with 41% was the hypophyseal portal vein. In second place with 24% was hepatic vein. So let's take a look and see what the correct answer is. And the correct answer is A, hepatic veins. So another challenging question. Let me go ahead and hand it off to Paris so he can explain to us why that is the correct answer. Paris.
Thank you, Sean. Yes, definitely a tough question here. So let's kind of go through those steps and those questions. Well, hopefully, you guys were picking up mainly on those acral enlargement and the weight gain. She also can't see things to the right, so maybe you want to start thinking about, a tumor in the brain, maybe a pituitary tumor or pituitary adenoma, okay, that can cause that bitemporal hemianopsia, okay? So they also tell us there's an elevated level of a pituitary hormone, okay? So hopefully you guys are picking up that this was acromegaly, okay? Acromegaly, that's step number 1. Let's take a look at the next slide. We kind of have a couple slides here. This is looking at acromegaly from first aid, okay? You can kind of see some of those findings in our patient. Large hands and feet, okay? That's a very big clue. Weight gain as well, okay? You can see there that the cause is listed is at the very top, excess growth hormone in adults. So the hormone that's likely elevated is growth hormone, okay? So that's step number 2. They then told us that growth hormone leads to the production of something else that causes a lot of the metabolic effects. Hopefully you guys picked up that that was IGF-1 or insulin-like growth factor 1. You can see there, that's part of the diagnostic modalities, okay? So that is step number 3. It was IGF-1, that is that second hormone that they're talking about, okay? And this is made in the liver, okay? So let's go ahead, let's go on to the next slide, actually. And you can kind of see there on the right, this is kind of some of the effects of growth hormone. You can see there in that image, that liver, right smack dab in the center, down at the bottom, and how growth hormone stimulates the liver to release IGF-1, okay? So we know IGF-1 is coming from the liver. Because of that, the next plausible place and vein it could go into is the hepatic vein. From there, it'll go into the inferior vena cava and on, okay? But the first most direct vein that it would enter from the liver is the hepatic vein. So a little bit of anatomy as well. So let's go back to our vignette and the other answer choices. Hopefully now you can see why that's the best answer there, okay? The splenic vein, that drains blood from the spleen, part of the stomach and pancreas, not what's going on here. The portal vein, for those of you guys selected that, remember the portal vein delivers blood from the GI tract to the liver, okay? The liver then has its drains into the hepatic veins, which then go eventually into the inferior vena cava. So inferior vena cava is also incorrect as well. And answer choice B, this connects the hypothalamus and the anterior pituitary. So that's more of a central issue. We just kind of walk through how this is related to IGF-1. So a few steps here. Hopefully, maybe some of you guys got tripped up along some of those steps. Maybe there were some other reasons, but a very nice endocrine question. Great way that they love to ask the second order, third order questions. So hopefully this was a good question for you guys as well.